Myself, Dr. Keerthi. I'm a pathologist working in Ajara hospital since 4 years. I have experience in laboratory medicine, including pathology and clinical pathology, hematology, various other departments, up to 8 years. Ajara hospital, we have highly equipped laboratory with the subspecialties of microbiology, biochemistry, and pathology. By end of this session, you will be knowing about what is lab safety, how to improve the quality, how to manage the critical values, and maintaining turnaround time, optimization of reagent procurement, equipment downtime protocols, and handling of records. So, what is lab safety? To maintain good quality and also atmosphere, we should maintain safety protocols. So, everybody who is working in our lab should be wearing PPE. So, general PPE for this laboratory should be long pants, safety glasses, along with the lab coat. Okay. So, because we will be dealing with the hazardous materials. So, wearing a proper protective clothing is best way to protect yourself and also lab person. So, you should be wearing full covered shoe. You should not be wearing any jewelry or any sandals, and your hair should be properly tied, and you should not be leaving your hair. Preferably, you should be wearing hair mask. And whenever it is not needed, not intended to touch any object, please don't avoid touching the object. And no eating or drinking in laboratory area. So because the stuff on your hands can spread to your work area. So, and also while going and coming to the lab, you have a habit of washing your hands thoroughly. No food items should be entered into the lab area. Whenever you handle the glassware, please take care of yourself and also equipment. Never touch any glassware or acids or chemicals whenever it is not intended to touch. And never touch or never deal with any chemicals if you are not have any idea how to use it. And also, you should have proper instruction guidance before doing any test. So, and again, also, this lab safety includes also waste management. So, every person in the laboratory, whether it is from grade 4 to high order persons, everybody should know how to dispose the waste. So, best way to dispose the waste is segregation at the creation of the site. So, whenever you are generating the waste, there only it should be segregated. You should not collect the waste and then you will be segregating. It is a wrong practice. So, wherever the generation of waste is there, then there only you have to segregate the waste. So, every lab should be equipped with all types of 4 color-coded bins, especially in sample area and in your work area. So that you will be, whenever you deal with any material waste, you will be immediately able to segregate it. So, this color coding system, tables and should be attached, color code things will be attached to guide all employees to know the taste. So, we here have waste. For waste management, we are equipped with the adequate numbers of dustbins with the pedal handle. Okay, so you should not be touching the bin cover. So it should be ideally pedal handle dustbins should be used. Okay, so coming to segregation of waste, so all the anatomical waste will be going into yellow, and all the plastic waste with the blood will be going into red bins, and sharps will be going into blue. So that as a laboratory, we'll be dealing with broken glass, ampoules and all that we'll be discarding into the blue. So general waste will be into the black. Okay. So then that includes our lab safety and waste management. So next comes our quality in the laboratory. So what is quality? So why we have to have quality control programs in our lab. So to attain highest quality assurance and quality control, we should be having quality control programs. So one should know what is quality assurance and quality control. So quality assurance is overall management plan to guarantee the integrity of the data system. Coming to quality control it is a series of analytical measurements used to assess the quality of analytical data. So it is not a single activity, it is a series of events. So every lab person should know, basic lab technician, everybody should know what is accuracy, what is precision. So accuracy is getting correct results, and precision is how well series of measurements is agreeing with each other. So in this diagram we can see what is accuracy and what is precision. So precision is how well, so if a test is done in twice or thrice, it should not be changing. The value should be accurate. Should be same. Accuracy is how correct it is to the correct value. That is accuracy. So why we should have good quality control in our lab? So we should support our system to provide good quality healthcare, and we should be able to ensure credibility of the lab and also to generate confidence lab results. So what happens if quality is not good? So sometimes what happens if the report has some error? So sometimes clinician may miss some investigation, he will not be able to diagnose properly. Sometimes it will lead to over treatment or under treatment. Sometimes the diagnosis will be misunderstood or the patient may be mistreated. And also sometimes for some results, if it is not issued properly, clinician will not be able to guide other investigations. So there may be some lack of investigation. Sometimes the action will be delayed if it is error. So, and obviously there will be loss of credibility of your lab, and sometimes it may lead to legal complications also. So what we should do to get good quality results? So we should be educating and training our lab personnel. So we should be having regular teaching activities to educate our staff, and they should be educated in various methods. Okay, and also next comes our controls used in the lab. So for all machines and all into like biochemistry and hematology, all machines should be properly equipped with the controls, and they should be well calibrated and well maintained. So controls, because we have to use at least 2 level controls to achieve a good quality results. And then reagents should be like, whenever we deal with all the reagents, we should select the good quality of reagents to get the good results. And equipment should be calibrated monthly, calibrated with the precise time given to the equipment, and also regular equipment, and also pipettes also. So everything should be calibrated. Then interpretation of the results. So there should be a qualified person to interpret the results and authorize the results. So every lab result should be checked by laboratory personnel to give proper appropriate results. And also, so to achieve these goals, we should have standard operating procedure for all machines, for all tests which we are doing in the lab. So for each and every test should have SOP, and also the SOP should be available for all lab personnel, and also there should be regular record of controls. So whenever you run the control, you should make a record of that control, and analysis of those controls should be done by a qualified person. And also you have to derive your own LJ charts to maintain your QC data. So whenever there is disturbance in your LJ chart, it will help you to assess the control and also assess the equipment. So, and also to not only regular controls, and also you have to compare with your other laboratories. So for that you have to have inter-lab comparisons, and also you should be enrolled to get get from the external quality control programs like EQUAS and REQUAS. So there are some institutes providing EQUAS and REQUAS. So you should be enrolled into that EQUAS and REQUAS program. So basically, whenever you are comparing internal lab controls, you should be having inter-lab comparison with the probably with the same. You should be sending some result for the inter-lab comparison. The machine should be same, and the methodology should be same. So for that, you should have some tie-up with the NABL accredited lab, so that internal comparison have some value. So how you are going to implement the QC program? So you should have a written policy and procedure, and also you should be monitoring and reviewing the results, and you will be training staff to have this control procedures, and also they should be able to run controls and also to assess the controls also. And you should have your own data to you have to collect your data so that you can go back to the data, and if there is any errors in that, so that you will be correcting. So root cause analysis will be maintained if you have your own data. So you should be able to establish your own controls, and also you should be preparing with the controls. You should be preparing with the LJ charts. So whenever there is problem, you should be able to troubleshoot those problems. So if you have your data in your hand, you will be able to do that. So whenever there is, you have your QC material. If there is any problem, if it is control is not working, or if there is any problem, so you have to go follow this flow chart to have proper troubleshooting. So whenever there is a problem, you have to check whether the material is correct or not, whether the control is prepared properly or not. When there is, while doing control, who is doing the pipetting, is there any bubbles during the pipetting, whether the reagent is expired or not. You have to see all that. And the reagents, coming to reagents, whether they are loaded properly, or do they have expiry date, or do they have stability is okay, whether the stability is lost, but do they store properly, or according to the manufacturer's given temperature should be maintained during the reagent storage. Okay, whenever there is problem, you also have to check for the calibration, whether calibration is correct, whether the curve is correct or not, whether standards are prepared or not. So all that you should be going. Again, you have to check for the analyzer. So is it presently, whether any recent maintenance issue is there, or what is the last time maintenance person came, all that have to go back and check. So by each and stepwise manner, you can get the root cause for the error, so that you can correct it. So, and you have to pay attention in the water supply of the lab. So whether it is distilled water supply is whether functioning or not, you have to see. So whenever there is problem in the error in the report, you have to go back and get the root cause, so that you will be able to troubleshoot the problem. Okay. So what are the quality indicators in our lab? So our lab, we receive all samples. There is no rejection criteria as such. So whenever we reject the sample, we have to maintain a notebook, register to maintain what is the rejection rate. So why, and whenever we reject the sample, what is the reason for sample? For example, if sample is clotted, so if routine hematology sample is clotted, so then we will be rejecting the sample. So we'll be asking for the other sample. So reason should be maintained in the register, so that we can give the proper advice to the sampling people and also to the ward people. So rejection rate and reason should be maintained in the register, and also sample redoing. So how much percentage of the tester we are doing, and what is the reason for the redoing, all that you should be able to maintain. So the rate, so per a week how many we are doing, why it is increased compared to the last week. So that you will be able to get the root cause for the redoing. And also turnaround time. So turnaround time is very important. So it will give average idea about the workflow. So where is the lagging period, why it is reports are getting delayed, all that you will be able to recognize the problem. So, and also critical values, corrected reports, and equation request, and internal comparison. So whenever there is IQs are failed, why it is failed. So you have to maintain proper registers for all these, and also you have to analyze these registers. So whenever there is a critical value, there should be a procedure for the critical value information. So you should have that register also. Then coming to our equipment calibration. So all laboratory instruments should be calibrated according to the scheduled time. So because calibration ensures the accuracy and also reliability of the equipment. So all the instruments, equipment in the laboratory should be calibrated in a scheduled times. So the company manuals will be given, they will be providing the time for the calibration. So, and also we should follow the manufacturer guidelines. So these guidelines and those books should be available for the lab person to check always. And also we should have proper contact numbers of the manufacturers and also company representatives, so that if there is any problem with the system, we should be able to reach them. So the person who in charges these labs, so they should have all company persons numbers and also manufacturers numbers. If there is any problem with so if it is not corrected by the local engineer, we should be engaged with them, so that they will be giving solution. So coming to reagent procurement. So depending upon, so already we have a data, so we know how much we use. So for every test, we should have some data to analyze the reagent need. So whenever there is there an emergency, whenever there is increase in demand, so depending upon the previous year's data, so you should be having some idea about the reagent usage. So, and also pattern and also requirement. So, and also there is you should be able to assess the reagent quality. So whenever you change the company, you should assess the test results, and if there is errors, so why it is happened. So you should be comparing with you should be able to compare with the test results with the different reagents, so that you will be knowing what is the best reagent for the test. So you should be able to assess the reagent, and also you should have all the numbers of the vendors. So you should be able to identify the reliable vendors. So, and also depending upon the data, you should order the reagents, and also try to avoid unnecessary reagent wastage. So you have to minimize the usage. So, and also whenever you have bulk order, they will be giving with the less prices. That is also, so for a company to progress, you should be able to guide a lab person for the proper reagent procurement. So if you have a bulk order, they will be giving for the less prices. So whenever if you understand the pattern of usage of your reagents in your lab, you can give bulk orders. So and also alternate source searching. Sometimes the vendors may not deliver the proper reagents in a proper time. So that you should have an alternate source for the reagent procurement. As I said, critical values plays a very major important role in the laboratory management. So whenever there is critical value, so every person in the lab who deals with the testing procedure, so they should know what is critical value. So we should have our own derived critical value depending upon the data available and the standards So we should know, we should have critical values and they should be pasted with and should be visible to everybody. So critical values for the different departments should be defined, and table should be signed by the department HOD, so that, and we should have a policy for the reporting of those critical value, and everybody should know what is critical value. So critical value is a value, if it is not addressed, that life will be in danger. So it should be correctable value, so that panic value, as a result, if it is left untreated, it should be life threatening. So that is critical. So whenever there is a critical value, you should be informing on phone before the dispatching of the results itself. So whenever there is so all the labs should have proper policy for the critical values information. So who you are informing. So these values should be informed within the 30 minutes of the results availability, and to whom we should inform. So we have to inform only respected consultant and also ICU doctors and ICU in charges. If they are not available, we have to inform to the primary physician also. If they are not available, if they are not reachable, you have to inform with the emergency doctor. If he is also not answerable, you have to inform to the medical superintendent of the hospital. So, and whenever you inform the critical value, so you should introduce yourself and you have to confirm with the patient name and also the value, and you have to ask the other person to read back the result. So, and then you have to say read back is okay, and you have to write the critical value and inform time and whom you have informed in a report, and also you have to dispatch the hard copy after the result, and also you have to maintain the critical value register, and all these should be entered in the critical value register. So critical value register should have patient name and the primary consultant whom they have reported, who reported, time, and if there is any primary physician is not available, what is the alternate number. All that should be maintained in the critical value register. So for every parameter, for every department, they should have separate critical values. Okay. And also whenever there is, as a lab, we will be dealing with the many equipment downtime. So whenever there is schedule, so that to avoid equipment downtime, so we should have proper communication and also maintenance schedule. So we should inform our clinical fellows and also other departments. So this is the maintenance time of this equipment. So we will not be delivering the results immediately. This is after that maintenance we will be giving the results. So that should be mentioned with the prior notice. So we should have planned equipment time. So all the instruments should be given some maintenance time. So we should have timings of all the equipment time, and usually we will be equipped with whenever there is workload, maybe after nights, that should be maintenance should kept in that time. So if there is sometimes we will be having some sudden breakdown of the equipment, so we should have some alternate plan. So sometimes if it is well equipped with the other instrument, that is well and good. So if it is not, we should have some alternate source for the test to run, and also sometimes, so that outsourcing is it is unavoidable sometimes. So we should have what is the nearest outsourcing laboratory, and we should have contact number of those person, and what is the method. So we should know where we are outsourcing and what is the purpose of outsourcing. So every person in the laboratory should be knowing. And also sometimes whenever you outsource the samples, you should prioritize the test. So what is the emergency test to be outsourced, all that should be, you have to prioritize. So whenever there is equipment down, So you should not be panicked. So you should have alternate plans. So you have to be prepared for the anytime emergency. So whenever but you have to give the information. So whenever there is problem in the equipment, so if for one parameter, if it is tried to do in other method, that is well and good. But if it is not able to do, we have to outsource outsource. So coming to turnaround time, so it is very much we should follow it, because every lab should decide turnaround time for the depending upon their workload and also their methodology, and also how well versed it is equipped with, and usage of automation and also technology. So all these will play major role in maintaining the turnaround time. So it is not like that you should have only this much of turnaround time for this particular test. It is not like that. Depending upon your workload and your methodology and LIS, all that will play role in the turnaround time. So you should derive your own turnaround time. So because if you give your reports within the turnaround time, it will give immense satisfaction for the patient, and also the immediate, if you give that results, the patient care is provided earliest. And so to decrease the turnaround time, every lab should be equipped with the new technology. They should be trained in new technology. So nowadays all machines are fully automated, so there is hardly any disturbance in the handling of this test. So turnaround time is drastically decreased in many laboratories. So you should be ready with the new technology and also software also. So whenever there is fully automated thing, it is usually all the labs are equipped with the LIS, so that we can directly get the results from the machinery. So there will not be any time wasting during the typing and all. So that's how you can decrease the turnaround time. And also whenever there is delay in turnaround time, if they are not delivered in the turnaround time, you should go back and analyze for the delay in those turnaround time. So whenever there is delay in sample transportation, you should have some alternate methods for the sample transportation. Likewise, we have some shoot so that samples will directly come to our lab. So that if you get the new technology, it will definitely give good results in terms of less turnaround time. So whenever there is any errors, so you should be able to recall the results. So before recalling, you have to confirm the error with the other methodology or other lab. So when it happens, you should recall the results. So whom to inform? So primary consultant of the patient should be informed, and you have to give the explanation for that, and also then you should be asking for the other sample if possible. So whenever there is to give good quality results, you should be giving less errors. So you have to take measures to decrease the incidence of those recalls. So these are the few points in implementing the good laboratory functioning. So implementing precision, safety and compliance as the cornerstone of the laboratory best practice to ensure reliable results and maintain a high standards in healthcare. Thank you.